My name is Scott Wilbert and I'm a physical therapist in the youth department of Moore Center.
My name is Toni McNeil and I'm an occupational therapist and certified hand therapist here at the Moore Center for Orthopedics.
Our philosophy for physical therapy at Moore Center is really patient and team driven. It starts when the patient first sees the physician and they talk about their diagnosis or how the injury occurred, and then we talk about that again and come up with really patient-centered goals during our physical therapy evaluation. And then we kind of get that together with the doctor's goals and our goals, come up with a team approach to the treatment for each individual. So Moore Center offers a wide range of physical therapy services. We offer spine center services, which just focus on spine problems with degenerative discs and disc bulges and all sorts of spinal injuries, including the neck. Our youth department, or our pediatric department, is kind of split up into two different sections. We have the pediatrics, which are infants to ages 8, and we have special equipment for those kids that fit better, that are really made for children. And then in the youth department we have equipment made for youth, ages 8 to 18. So we can really specialize for the age ranges and sports as well. In our youth department we have basketballs and footballs and soccer balls and equipment to train for sport-specific injuries or to get those kids back to their goals.
The occupational therapy services that we offer in the hand center where I work are actually mostly orthopedic based. We serve patients from the shoulder, elbow, wrist, and hand, and we treat patients that are primarily fractures, dislocations, tendon injuries. We have a lot of patients who have had total joint replacements, including the shoulder and elbow as well as the wrist. We also see pediatric patients that are mostly from injuries involving the upper extremity. We see burns, we see a lot of wound care patients, and surgical management of the hand for tendon lacerations and crush.
In the youth department, our two primary diagnoses or two primary problems that we treat are scoliosis and patellofemoral or knee problems. But we see everything from post-surgical cases to motor vehicle accidents to just regular sprains and strains. We see a lot of dancers and gymnasts, as well as your typical football players, soccer players, and basketball players.
I think that Moore Center is different from other clinics. Number one, by the level of therapy that we have here as far as the educational basis and also how much background we have. Most of our therapists have been doing this for 10 to 20 years. We strive on performing best through continuing education and making sure that our standards are as high as possible. We also have a really good connection with our doctors, so if any issues arise in the clinic with our patients, we're able to have contact with them frequently throughout our treatment sessions. So having that close connection really helps us to provide the best care for our patients.